Hi, it's your psycho buddy. Sometimes psychiatric diagnoses matter, and sometimes they're toxic. And it's up to you to decide which is which. So here's how I decide. Um, Over the 31 years that I've carried diagnoses, they have been just shoveled on. Lots of diagnoses. So I just wrote down some and I tried to keep it to 8 and failed. So here are the things that I've been diagnosed with: severe depression and suicidality, generalized anxiety, bipolar with intermittent psychosis, schizoaffective disorder, borderline personality disorder, autism spectrum disorder, post-traumatic stress disorder, complex, structural dissociation, and dissociative identity disorder. Um, all that shit. So here's how I decide if I'm going to pay attention to something or not. At first, I really identified with the diagnoses I was given. So I used to say, as many of us do say, I am bipolar, and I am manic depressive. And I, when I found out over years that when I identify with a disorder, I come out. Oh, neurodiverse, of course, is on there too. Neurodiverse is a superpower. It's not a disorder. Um, when I identify as something, then the symptoms of that thing get pronounced in my behavior. And for that reason, I have strategically not identified with 8 of the 9 diagnoses on that list that I just read you. There's only one of them that I think is safe to identify with, maybe 2. I'm kind of leaning in that direction now. And so before I tell you how, there's a little Chinese fable that is very relevant here. So there are these 4 blind men who are trying to figure out what something is. And one of them like kneels down on the ground and puts his arms around it and he says, "Oh, it's a tree." And the other one is standing up and he says, "Oh no, look, it's a rope. It's long and skinny." And then the other one says, "No, it isn't. It's a hose. It's like a tube and it's open at the end." And another one, the fourth dude, is standing there and he's puts his arms up and he says, "No, it's not. It's a wall. It's a wall." So what are the 4 blind men touching? They're touching different parts of an elephant. And they're each describing what they have access to and what they recognize. They're describing it in terms of what they recognize. So with psychiatric diagnoses, in my opinion, the psychiatrists and clinicians are blind men who have expertise in one area or a cluster of areas. And when they see my constellation of traits and behaviors, which we can call symptoms, then they categorize it according to what they're familiar with. They're not doing anything wrong. They're just recognizing, oh, she has this and this and this, which is what all of my other patients who have that have, right? And so then they say, oh, she has bipolar. Oh, she has schizoaffective. Oh, she's has autism, whatever they are, all the things, all the many things. What's important, though, is whether a diagnosis indicates a course of treatment that is useful. If it does, take the course of treatment. Whether or not you identify with the diagnosis, whether or not you think the diagnosis is right, try. If it suggests a new way of dealing with your problem, try it. And if it works, maybe the diagnosis is right, but it doesn't actually matter I mean, what matters is that your insurance paperwork has a diagnostic code on it so that your insurance will pay for your mental health care. That's what the DSM-5, the Diagnostic Statistical Manual that they use, that has all the criteria for the different, that splits the spectrum of behavior into discrete disorders. The Bible of Psychiatry is called the Diagnostic Statistical Manual 5. And that's why they need to identify diagnoses. But it ends up, for me, and this may well be different for you, I know this is different for a lot of people, but for me, the diagnoses feel like judgments. Like you're wrong in this way. Oh, great, now I'm wrong in the way of my behavior looking autistic and sticking out in society. Now I'm wrong in having manic behavior that sticks out in society. Oh, now I'm wrong in whatever way that sticks out in society. So there was a quote that I heard someone say in college who told me the only difference between enlightenment and insanity is who you tell. And at first, I was really pissed off by that because there's a lot of truth to it. A lot of the criteria in the Diagnostic Statistical Manual, the DSM-5, actually do involve the reaction of the people around you. It causes distress to the people around you. It makes you not fit into society. That is actually a criteria of a number of disorders. And I was pissed off. I was like, how is other people's reaction to me something that determines whether or not I get labeled as broken and crazy? And then years passed, and I thought about it a lot and realized that there's validity in it because we're human animals, we're pack animals, and if our behavior ostracizes the people around us, then that can put our survival at risk. So it actually is a type of illness or disorder or something is wrong if we can't calibrate our behavior appropriately to the expectations of the people around us. But on the whole, I would say if you are pissed off about a diagnosis you've been given, if you feel insulted by a label, think about it in terms of, does this diagnosis suggest any new course of action to make my life better? And if it does, take the course of action. If you think the diagnosis is wrong, it may well be. It's just a decision somebody made. And maybe it's a decision 5 people made, but it's just their opinions, and we're all blind men. For me, the one disorder that I think actually covers it all is complex post-traumatic stress disorder. And the reason that I've chosen to allow myself to identify with that one is that it heals. You can heal it. Some of the others don't fit that criteria, and I want to be able to heal. I want to be motivated to have behavior and make decisions that are good for my own health. Whereas when I believed that I had bipolar, I was like, what the fuck? Like, why bother? No matter how good I feel, I'm just going to feel horrible again. Why survive? And that was really a toxic perspective for me to take. The complex PTSD covers or causes the structural dissociation and dissociative identity disorder. So I do think that those are valid as well because they suggest productive types of therapy that the other diagnoses don't suggest. And if you feel comforted by having a diagnosis, I know I've read that a lot of people do actually like being told, oh, your thing is adult ADHD, or your thing is autism, which nobody ever knew before. And then you're like, oh, that's why I behave this way, and that's why people treat me this way, and it actually is a weight off. That's more power to you. Like, if it helps you to have a diagnosis, that's great. Believe what you need to believe to make good decisions for yourself.